Chapter 14, Mental Disorders. Symptoms and diagnosis. There's at least 4 pain symptoms anywhere in the body. 2 GI symptoms, nausea and vomiting, or blood in the stool, or 1 sexual, 1 reproductive, 1 neurological, and there's no clinical finding for why they have the symptoms. Treatment is psychotherapy, including behavior modification. Prognosis is very poor because finding a diagnostic test that proves anything or find an absolute diagnosis is difficult. It continues to be chronic and rarely goes into remission. So it's just supporting the patient and helping them through the phases. Conversion disorder is when anxiety is too difficult to face, and as a defense mechanism, the person has physical symptoms that allow them to escape whatever the situation was they're wanting to avoid. Usually this is caused by something that's really highly stressful. It used to be called hysteria as a diagnosis. Symptoms of conversion disorder, deficits in voluntary motor functions, so inability sometimes to move parts of the body, or those tics or things like that. They are overly sensitive to pain or even to touch or sound. They have speech disturbance, loss of voice. They may have headaches and difficulty swallowing or breathing. They have a significant social and occupational functioning, and with initial symptoms, they require prompt treatment and attention. Treatment is psychotherapy and hypnosis. The course of the more acute phase of the disease is short, with a few of them resolving as quickly as in a few weeks. And usually whatever's been stressful has been removed. But it does tend to recur. Prognosis depends on the intensity of the stress. And basically, this is one where they have to find ways of dealing with stress. Pain disorder is pain that causes significant distress and physical and social impairment. It is altering their life, basically. It's very real to the patient, and takes control of everything they do or everything they are part of. Symptoms: severe lasting pain, can be musculoskeletal, neurological, can be malignancies. It is not something that they intentionally produced, so it is something that's there's actual cause for. It can be difficult. The response to pain depends on the patient's interpretation, but the pain interferes with their life, their activities, and it may be associated with a number of different organ systems. So this is one that may be seen reasonably often. Treatment for pain disorder is look at the underlying conditions and address those as it would be appropriate. Psychotherapy, relaxation techniques, narcotics if the pain can't be managed any other way. There's going to be some pathological changes on diagnostic studies. Insomnia is usually referred to when you have a patient who is having considerable difficulty falling asleep or staying asleep, and this is usually over at least a reasonable time frame. Symptoms: as a result of poor interrupted sleep, they feel sluggish, tired, groggy, tense, anxious. Some people feel like when they get up in the morning they haven't rested, It's not an emergency, but whenever it is something that's chronically a part of their life. Possible causes of insomnia include some kind of physical medical problem, zone changes, or jet lag. Some people suffer from this considerably when they travel, say, across the country. High altitudes, like you live in this area and you go out west. Stimulants, coffee. A lot of people can't drink coffee after early afternoon or it keeps them awake. Steroids, alcohol, nicotine. Psychologically, anxiety, stress, fear of sleeplessness may be causes. Um, in They can also have things like for shift workers or those kind of people who change their work time periodically. And a lot of things can also be environmentally related, like being too hot, too cold, it's too bright, it's too light outside, that kind of thing. To be diagnosed with insomnia, then the symptoms have to have a duration of longer than a month. They have to interfere with normal functioning, social, occupational, and other areas. Polysomnography, that is sleep studies, or recording of them as they sleep, might also be used. 24-hour usually studies are what's used. Um, Insomnia typically increases with age and also is higher in females. Treatment: identify and eliminate the cause of sleeplessness. Change the lifestyle to reduce tension, stress. Keep regular sleeping schedule and hours. Eliminate noise and disruptions that would distract and keep you awake. Use bedroom for sleeping only and not work. In some cases, they'll say don't watch TV in bed also. Keep a regular bedtime and regular time for getting up. Having a darkened room and a quiet environment. And then when those things fail, maybe psychotherapy. Treatment: avoid caffeine, nicotine, and stimulants late afternoon and evening. Avoid strenuous exercise several hours before bedtime. Use medications only if all the other things haven't worked. And some people use melatonin or benzodiazepines, but